Hi, this is Dr. Serena Satcher, and I'm talking about stress this month. So, the next question is there anything that might look like stress, but is something else? So, hormonal issues like problems with the thyroid, like the thyroid either being high or low, blood sugar issues or high or low blood sugar, male and female hormonal issues like menopause, and we call the male version andropause, or like in a male, if their testosterone is too high, that can also cause anxiety. um, these things should be considered also and may contribute to anxiety, depression, and other mental health issues. And also, there can be a worsening of mental health issues that I mentioned before that may also look like stress and may require that they see a doctor pretty soon or urgently. And the person may need to have a physical exam, and they may need to have some lab workup to be able to tell exactly what's going on.